Hey guys, it's Doc Heps here. What if I told you I was going to take a pen about the size of a Sharpie, put it through your skin, into your kidney, and suck out some stone? Well, it sounds pretty horrible. We're going to walk you through it, so stay tuned. Hey guys, it's Doc Heps. So we're going to be talking about PCNL, percutaneous nephrolithotomy. It sounds horrible, but it's probably the most efficient way to get rid of big stones. So first bit, what is PCNL? It's an acronym. It stands for percutaneous nephrolithotomy. PC stands for percutaneous and NL stands for nephrolithotomy. Basically, we go into the kidney and break up the stone and remove it in different forms or fashion. Why do we do this? Well, a PCNL is performed generally for larger stones. If I had to put a number on it, usually it's for stones that are greater than 1.5 centimeters or 15 millimeters. And that's a good sized stone. For example, a 5 millimeter stone has about a 50-50 chance of passing. So once these stones get up to 1 centimeter or 10 millimeters, 15 millimeters and beyond, they're unlikely to pass, number one, and sometimes they take a little bit more invasive treatments to try and get rid of that stone in the most efficient fashion. The main benefit of a PCNL is to get rid of a stone, again, in the most efficient manner. Usually we can get rid of the vast majority of the stone using a PCNL in one treatment. Although it's more invasive, we can do it in a single session. Whereas if we do it in lesser invasive ways, oftentimes you may need more than one procedure. Next question is, how do you diagnose a stone like that? Well, most commonly, these stones are identified with some sort of imaging, either initially with an ultrasound and a follow-up CT scan. Sometimes they see it during a plain x-ray. Oftentimes we just find it incidentally, meaning you're looking for something else. Maybe you have some x-rays or MRI or CT of your back. In the periphery, they see that there might be a stone in your kidney, and further imaging will reveal that in some folks, they may have a bigger stone than they even expect. So why would we even go after these stones? Well, oftentimes, these stones can be asymptomatic, meaning you don't even feel anything. But what can happen over time is these stones can cause infections, they can cause bleeding, and they can cause deterioration of that kidney over time. So those are reasons that we, as urologists, might recommend treating these stones, even though you're not feeling anything. What are the treatment options for stones in general? So one option is just doing nothing and watching it. Sometimes it's the right thing to do if you have a lot of other medical problems and the stone's not bothering you. Another way we go after the stone briefly is called ureteroscopy, where we take a scope and guide it from below in the urethra, into the bladder, up the ureter, and into the stone, where we can use different lasers to try and break the stone into little bits. Usually this treatment is reserved for smaller stones or stones that are stuck in the ureter. There's also a totally non-invasive treatment called ESWL, or extracorporeal shockwave lithotripsy. And this is a treatment where a machine is placed up against the skin of your back and shockwaves are delivered precisely to that stone. This is used for stones typically that are in the kidney and are less than 1 centimeter or less than 1.5 centimeters. The benefit is that typically shockwave can be done under a lighter anesthesia and is totally non-invasive. But unfortunately, if these stones break into larger fragments, they can get stuck and make you pretty miserable on the way those stones go down through the ureter. Back to PCNL. Some of the intricacies of PCNL include it's done under general anesthetic. It's more invasive than ureteroscopy or shockwave, but typically will make one small incision that's less than an inch. There is a potential for blood loss. The kidney is a vascular organ, and we make a small opening in the kidney to get to the stone. So although this is unlikely, it's a potential problem, and oftentimes we'll keep you overnight in the hospital to ensure that there is no issues in the recuperation. Also, there's a potential for injury to the kidney. Biggest benefit of a PCNL, it's your best chance for getting rid of a large stone in one sitting. So how do we do a PCNL? Well, it's done under general anesthetic. Typically, it starts with a wire or tube that's placed from the back or flank region through the skin into the kidney and then into the drainage system of the kidney. So that wire is passed all the way down into the bladder, and then typically we'll stretch the skin, creating a channel so that we can get to the stone from the skin in the back. We use a special balloon, and then over that balloon, we slide a little tube that provides us an access port directly to what we call the collecting system. So a tube is slid over that balloon directly into the collecting system where that stone is, so we can see the stone using a special scope. And then we use this energy to break that stone into little bits. And on that energy system is oftentimes a suction that once that stone is broken into little sandy bits, we can suck that stone out. And sometimes through that channel, we'll take any residual or larger pieces that we can get out to ensure that you're as stone free as possible. Once the stone's broken and sucked out, there's a lot of inflammation in that kidney. So we use stents or little tubes to allow that kidney to heal. Some urologists will place a stent from the top of the kidney all the way down into the bladder. Other urologists will place what's called a nephrostomy tube, where it sits in the kidney and then comes out through the back in the skin, and that drains into a little bag. And some urologists use both. It often depends on the way the urologist was trained, how big the stone or how much inflammation there is. And either way, it's a very effective and essential way to allow the kidney to heal after that stone is removed. We secure that tube, oftentimes a nephrostomy tube, which is draining from your side, with using a little stitch. We take it to the recovery area, and typically you'll stay overnight in the hospital. Usually the next morning, we'll remove the catheter that was in your bladder, get you up moving around, see how your pain is, ensure you're able to urinate well, ensure that there's no significant leakage around that tube and that incision looks healthy. So once that's good and you feel comfortable managing the tube, then you go home. Most people, at least that I take care of and do PCNL on, will go home with a nephrostomy tube, and we'll teach them how to clamp it. So typically the nephrostomy tube will stay to drainage for 24 to 48 or 72 hours. There's a little stopcock on that nephrostomy that can change from draining the tube to the bag externally, and you turn it by 90 degrees, and then that tube is blocked off. That's kind of a test to see that urine is draining in the proper direction. If you clamp that nephrostomy tube with that stopcock and you have a lot of leakage around the small incision from the side, or you have a lot of discomfort, then you can go ahead and open that up again and ensure that it's draining back into the bag. That means you're not ready. There needs to be some more healing going on prior to closing that. Usually, you wait a 24-hour time period and try it again. And if you clamp that tube and you don't have a lot of leakage or drainage around that incision where the tube is, and you don't have any significant discomfort, that means that the urine's draining in the proper direction from the kidney down into the bladder. Usually you clamp it for a day or two, you come back into the office, and it's removed without a hitch. It takes about 30 seconds to remove a tube. Some guys definitely will feel a little twinge, but it shouldn't be painful. Most times I ask my patients to take some ibuprofen prior to their office visit in anticipation of removing the tube, and they do fine. They're more than happy to come in, and it's not a huge deal. They're happy to get that tube removed because it's obviously a little bit of a hassle to manage. When you go home, oftentimes you'll see a little bit of drainage around that tube, and you can use a gauze pads, and the nurses, before you are discharged, will give you gauze. You can leave it on there to absorb any excess fluid. Usually that dissipates the further out you are from the procedure. It can last from up to 24, again, to 72 hours, but most times it heals up quite nicely. Also, you can get in the shower, move around. You shouldn't be laid up in bed. After any surgery, you shouldn't be too laid up in bed. We encourage you to walk around, stay active. You don't want to do any tub baths or go swimming or any heavy duty activities, but definitely some light duty stuff is perfectly okay and actually encouraged. There's really no dietary restrictions other than staying hydrated and avoiding constipation. Those are two things with any surgery that can sneak up on you. In terms of follow-up, once that tube's removed, oftentimes I will get an ultrasound of the kidney as well as an x-ray. The reasons being, I want to ensure that kidney has healed up. There's no silent swelling or what we call hydronephrosis, which the ultrasound could pick up. The x-ray often will see any residual or small fragments, and sometimes we may supplement that with a CT scan. I think that goes over PCNL, or percutaneous nephrolithotomy, in a expedited and quick fashion. It's definitely a more invasive procedure than your more traditional procedures for smaller stones, such as ureteroscopy or shockwave lithotripsy. But again, it's the most efficient way of getting rid of a big stone in one sitting. So I appreciate your time and thanks for watching. Check out our other videos and take care.